This meeting is being recorded.
Assalamu alaikum, ladies. Welcome to the talk today. We have lovely Sister Ishita here from Osteo. Walaikum assalam. Sister Ishita is founder of the Osteo in Motion. So she is osteopath. And that's what we're going to be talking about today, osteopathy and how it can help us and our babies, inshallah. So let's start with the usual question. What kind of brought you to osteopathy, Sister Ishita? How did you find out about it? What was your journey?
My journey kind of started, so a little bit of background and personal information. So I was diagnosed with something called Crohn's disease when I was 15. And off the back of that, I used to get really bad low back pain. So I used to go and visit an osteopath myself when I was about 15. I was always interested in holistic health and medicine, basically. So I did see myself becoming a doctor in the future because I was always good at sciences. However, stress makes my condition really, really bad. So I thought, you know what? And my parents thought, let's not go into studying medicine or something really difficult where it can be quite stressful for you. Maybe look at alternative therapies, etc. At the time that I used to visit the osteopath, I was quite young, so I didn't really ask many questions. I didn't really understand how to get into osteopathy. But yeah, when I started looking into career prospectuses, I kind of found it, and I kind of applied on the wing of it because I was like, oh, this is something different. I don't know if I'm gonna be okay with it, if I'm gonna be good at it, but I'll do 2 weeks, and if it doesn't work out, then I'll look into doing another degree or something, you know. But yeah, first 2 weeks in, I absolutely fell in love with it because it's just everything I like about biology. So it's the human body, it's anatomy, it's physiology, and it's about human bodies basically, which is what I enjoy more than, let's say, plants and zoology. So yeah, it was a very difficult 4 years. So yeah, it was a very difficult 4 years, but alhamdulillah, like I got through it.
Alhamdulillah, alhamdulillah. So it's a 4-year course, right?
Yeah, so it's 3 years bachelor's with 1 year integrated master's. So one of the positive things is that obviously it's not a very saturated degree. A lot of people don't go into it because there's pros and cons to it, as it is with any profession. But I think one of the main things is when a young person is looking for a career, what to go into, they kind of want a set income. You kind of come out of osteopathy as a self-employed practitioner. So you have to understand the kind of life risks you're taking in terms of what you want to do with your life and how you see your career progressing. So yeah, it's just, it's not, because you've got the academic side and then you've obviously got the business side. So people sometimes get put off with the business side. But alhamdulillah, it's not bad.
Alhamdulillah, you're here, and that's what matters, and that's amazing.
Exactly.
So, okay, so you said that you found osteopathy when you were quite young and you didn't ask many questions. So for someone who has never heard of osteopathy or who is very new to that concept, or maybe saw an osteopath once but also didn't ask many questions, how would you explain what osteopathy does? What is it? Yeah.
So osteopathy, I would say it kind of falls under allied healthcare profession. So you're an alternative healthcare practitioner, but you're funneling into musculoskeletal health. So in terms of that, osteopathy is a very hands-on type of treatment that you have. So we're not using machines, we're not using like any kind of radiography or anything like that. We are treating musculoskeletal conditions via our hands and the techniques that we get taught over the 4 years, whether that be there's so many techniques that we obviously learn over the 4 years to help anyone with any sort. So it's really important to understand osteopathy isn't just for back pain, which is commonly what people think it is. Oh, it's osteo. People know osteo means bones, and you're just treating the bones. No, we treat muscles, bones, ligaments, the whole works. So it's kind of into, like, osteopathy is different, you can say, from physiotherapy, which is more rehab based, chiropractics, which is more spinal based, but we're looking at the body in a more holistic manner. So you're doing gentle techniques to bring back range of movement to the body, improving flexibility, reducing pain, using different techniques. So we also look at the key difference is obviously our philosophy, which is, I don't need to get into, but it's kind of looking at the body. What's the person's occupation? What's the person's lifestyle? How many children has a person had, say if they've got children, lots of different things, and you kind of form a picture of how to help this person
Right.
in a more well-rounded way, as to say, okay, these are the exercises you need to do. Off you go, do them. If you get better, you get better. If you don't, you don't. You can't kind of treat it like that. So I would say, in a nutshell, if I was to explain osteopathy, it's hands-on therapy to alleviate any musculoskeletal conditions you have. But, our speciality is looking at the spine and any bones and joints that are affected alongside it. And then there are other niches that we also go into.
Okay, mashallah. Thank you for explaining that. So, if someone comes to you for a treatment, what can they expect? What would a typical session look like? Do they have to undress and, like for a massage or something? Or how does it all work?
So all practitioners work fairly differently. The kind of standard is, yes, we do need to see your body. So if you are fully veiled and you are covered, we will need to undress we will need to ask you to undress to some extent. However, the new guidelines for the past fair few years has been, you do not undress the patient if you're not treating, like, you do not need to ask the patient to undress if you're not treating that area. You just need to access the area you are treating. Before it was different. You need to assess the whole body, blah, blah, blah. But now things have changed, alhamdulillah. So when you first come into osteopathy, you obviously book an appointment, and there's not many questions asked on booking the appointment. Yeah. So when you come in, we have quite an in-depth, but not an extensive consultation, and it's just for us, with more years of experience you have, it's just for us to understand where the root could possibly be coming from.
Right.
So we kind of ask you the site of pain, any referred pain, neurological pain, what makes the pain bad, what makes the pain feel better, what's happened in your life, even if it's the smallest of changes, like I've moved houses. So with a house move, you could have you were probably sleeping in a different mattress and have a different pillow, and that could be like a little factor, to why you've got a new back pain that's come on. We're also trained in looking out for yellow flags, red flags. So if you are not safe to treat, for example, you've come to me and you've said, I'm a cancer patient, I've just got diagnosed, but I've got extreme bad back pain and I need that treated. I will not lay my hands on you, for example, right? Unless told by a GP, unless I've got confirmation that you're safe to treat, or unless you're completely in remission. There are certain conditions where we would just not touch the patient, right?
Okay.
We would send them directly to A&E. But that's not very common. Yeah. If someone knows they need to go to the A&E, they'll go to the A&E. We're also trained to know if that person has a fracture or not, etc., etc. Say they've had a fall. I've had people have falls on buses and pavements, and instead of going to the GP or A&E, they've straight come to me, and I'm like, "Girl, you've got a fracture. You need to go to the hospital."
Right.
Exactly. So yeah, so we do this in-depth consultation. Also, sometimes people, they just look at the site of pain. All right. They focus on, I've got a shoulder issue. But actually, when you start asking them questions of, oh, have you been recently feeling like you've got a headache? Have you been recently feeling nauseous? Have you been feeling this sort of way? Then you can gather that maybe this is a referred area. However, the pain is actually coming from the neck, and you want to treat them and then you educate them. So that's aside, they're safe to treat now. Then you ask them to undress. Usually if it's, a a Muslimah, you'll ask them to take their hijab off. Obviously, with myself, everything's enclosed, my clinic space. So you ask them to take their hijab off and possibly the abaya off. They can be in a tank top or a long sleeve top and a pair of loose trousers. I do recommend like wearing loose clothing to osteopathy appointments because you're having stretching techniques done. You're asking
Right.
them to move around. So like plazo pants or skirts or something like that, you know, or
Yeah,
leggings
yeah,
underneath your clothing. So that's typically what I ask my patients to wear. And
so they get this recommendation or this suggestion before they come to you, like what to
yeah,
wear.
so I always say to my patients in the confirmation message, please wear loose clothing, please bring any medication, because a lot of the
Right.
time we need to know about drug interactions as well and what drugs
Okay.
they're taking. Sometimes patients don't know the name or they forget, so it's better to bring it in. If they know it, it's fine. And obviously just some vague information about, you know, if they're having hijama done, not to eat before the appointment, etc., etc. And then if they specifically ask, what should I wear, sis? Because, you know, this is how I dress.
Yeah.
Or is your place enclosed because I'm a niqabi? And I'm like, yes, it is. All that kind of good stuff.
Alhamdulillah.
Yeah, so all that good stuff. And then we'll go on to assessment. So I'll do a rough assessment of the area that they've got pain in, or I feel like, okay, this needs to be checked out. And sometimes, you know, what I love about what I do is sometimes patients are like, no, the pain is here, but then I go to move the other shoulder. They're like, no, I didn't realize I've got pain on this shoulder, and it was just like, yeah, because you've not been moving this shoulder. So all these kind of things, and then treatment starts. So treatment will include deep tissue, soft tissue, stretching techniques. So we call them muscle energy techniques to basically lengthen the muscle that's affected in certain areas. Spinal adjustments, or the clicking that some people are scared of, some people enjoy.
Yeah. The famous clicking of the bones.
The famous clicking. And I personally use Graston therapy to work on the fascia. Sometimes I use a vibration muscle, like a massage gun, to work on like the glutes or the shoulder where there's a bit more muscle bulk. I also trained in dry needling, which is similar to acupuncture. However, I don't follow the Eastern route. I just use it to treat the muscle.
Right.
So I use that. So there's loads of different things I use within the hour session that I feel is necessary to hopefully get that patient to feel better. It's really, really subjective, to be honest. The more chronic your pain is, the more old it is, the longer sessions you may need, the more treatment you may need.
Yeah.
The more
Yeah.
acute it is, typically it's more inflammatory. So one session could be fine. Couple of sessions one or two sessions could be fine, but we don't do bulk sessions like chiropractors do. So if you're like, how many sessions I need, I can't say you're going to need this amount, X amount of sessions.
Right.
It's as you go. You can
Yeah.
buy like packages, or you can say I want 5 sessions and I'm going to do them once a month because I want it more as preventative and maintenance, which is what osteopathy is amazing for. So if you want to
Amazing. Yeah.
maintain good health and prevent further problems, because you're a desk-based worker, you naturally fall into a bad position, then yeah, by all means.
Yeah, yeah. Alhamdulillah, that's really good. I think that's really important to say that, you know, it's hard to say how many sessions somebody needs. It depends how the body also responds to the treatment, right?
Yeah.
So that's one thing. And also sometimes, you know, we might feel better after the treatment, but, you know, a few weeks down the line, it might kind of start creeping back, especially if you still have that sedentary work, crouching over the computer or something. So yeah, that's really great that you mentioned that. And related to that is also my next question, whether, you know, you've met lots of people who come to you maybe for the first time. So did you encounter any myths that people may have about osteopathy, or any fears? We already mentioned the cracking bones. And
yeah, actually, that's actually one of the biggest misconceptions about osteopathy. So I have to touch on that, which is all we do is crack bones. So yeah, in reality, there's that's only like literally probably 5 minutes of what we do. And hence why a chiropractic session is 10 to 15 minutes and an osteopathy session can be an hour long. So
Oh,
it's
wow, I didn't know that.
yeah, it can be half an hour to an hour. I personally like to do an hour session.
Well, I didn't know that the chiropractic do only such short sessions.
Yeah, short sessions.
I thought they have longer ones as well as the osteopaths.
No, unless they also do a lot of muscle work, which
Right,
I've
right.
worked in 2 chiropractic clinics, and the max appointment is 15 to 20 minutes. And that's
Wow.
including a bit of chat, which is fine because that's what works for certain people, you
Mm.
know. But if you want something a bit more in depth, then I would suggest osteopathy. And so yeah, so that's kind of like a small part of what we do. So one thing to remember is like our techniques are a lot more gentler. Like we do lots of soft tissue techniques and things like that. Another myth that I get is osteopaths only help with back pain, like low back pain. That is kind of typically what we're known for. However, osteopathy is a lot more broader to what we treat, and the range of conditions that we can treat, including like headaches, migraines, pelvic pain, postural issues, connective tissue issues, any issues really related to joint pain, wherever that may be. People can have symptoms that are related to poor sleep, poor digestion, stress related issues, tension related issues. We can work on the vagus nerve to release stress and tension. So there's so much we can do, you know, to reduce headaches as well. For example, myself, I do a lot of CPD courses and things just to improve my knowledge because you never stop learning. And I really enjoy doing facial acupuncture and the back of the head acupuncture to release the muscle tension in the face and in the back of the head to help with migraines, for example. And yeah, another one is like what I just said before as well about maintenance and prevention is people feel they can only see an osteopath if they're in severe pain. So that's another myth. Oh, I'm not in pain, so why should I visit an osteopath? Kind of thing. But I have, now that people are getting more educated, alhamdulillah, people are coming in just for preventative, just sister, I just want my back checked, sister, I just, you know, I've given birth, I'm fine, but I just want to make sure everything's okay. 99% of the time we will find at least something that's an issue. And we can nitpick on some things. And yeah, so it's just about like kind of maintaining good movement, managing stress, supporting them through different stages of their life. And yeah, whether that be postpartum, prepartum, pregnancy.
Okay, yeah, that's really great. Lead to my next question, because obviously lots of women, well, there are only women in my community, and lots of them go through pregnancy, birth, postpartum. And I often do tell them, go and see an osteopath in pregnancy after the birth. So can you just explain maybe a little bit in more detail, how can osteopathy help them in pregnancy, around the birth, after the birth? What benefits would there be, even if the woman does not necessarily feel any pain, in terms of like the pelvic alignment, preparing for birth, things like that?
So one thing is that a lot of people worry that treatment will be unsafe or painful. So what it's important to remember, we do not typically treat patients in the first trimester, just so that we can avoid the critical stage. And also there's not enough studies, or if any studies, to show osteopathy safe in the first trimester.
Right.
Yeah. We can do like even with massage, to be honest, you shouldn't have the first trimester. So once you pass your first trimester, osteopathy is completely safe and good to do. So let's talk about why it's good. So if you look at the anatomy and the physiology, or the anatomy of the body and how it changes during pregnancy week to week, your hips are literally rotating forward every single week. A little bit more, the gravitational force of your stomach is pushing you forward, right? So that is making your back arch a lot more. So all the muscles in the back are working a lot harder to support you while you're standing and sitting. So that can become very, very sore for a lot of people. That's putting a lot of pressure on your lumbar spine, which is the lower back. A lot of people get sciatica because of that, because the
Yeah.
sciatic nerve comes from the lumbar and the sacral spine, right? Your glutes are working harder, so to support yourself, right? So your glutes are working harder. That can also impinge your sciatic nerve. We also get common conditions such as, yes, sciatica, sacral girdle pain, so low back pain, where the hips are almost kind of feels like crushing your low back bone.
Yeah,
A lot of people get pelvic girdle pain because they're heavier in the front. So the pelvic bone in the front is only separated by a small cartilage. So you can imagine there's not even another third party bone there that's separating it. So there's a lot of pressure on that. So you get the lightning crotch kind of vibe, and people in a lot of pain. Yeah, a pain into their groin area, rib pain, understandably, depending on the positioning of the baby. You get other conditions such as carpal tunnel because of fluid retention. The bone,
that seems to be quite common.
very
Carpal
common.
tunnel. Yeah.
So the bones get closer together, which impinges the median nerve, which passes through. So typically, you'll get pain in these kind of fingers and half of this one, and that usually subsides after pregnancy. And you also get a lot of neck tension, upper back tension, because your chest starts to grow, and the more far along you get, and naturally that's not your size, so you kind of arch inwards a little bit. The back muscles get weaker. Weakening means they're more strained and they get more knotty. So things like that we can definitely help alleviate, maintain the symptoms. Yeah, because
Yeah.
these are all functional things that are happening to your body. And these are functional changes. So with functional changes, helping reduce that muscle tension, working on your hips to stretch them out so that when you do go into labor and you're able to do squats in your last 2 weeks before you go into labor, you're more flexible. You have your inside of your leg muscles worked on. You have the hip bone really
Yeah.
rotating beautifully. You have that little bit of tension relieved from the ribs. Yes, you will still be in somewhat pain because we can't get rid of it within pregnancy, but some pain we can, like sciatica. If it's muscle tension, we can just work on that muscle, release that muscle, and the sciatic nerve gets released. Pelvic girdle pain, if we create less pressure there because we work on the ligament rotundum under the stomach, you can relieve that pain. So there's a lot.
100% with my last 2 pregnancies. I saw osteopath regularly every month from like 20 weeks, just because of the pelvic girdle pain, and it was amazing. It was life-changing.
Yeah,
because
honestly.
I wasn't in any pain. I could move perfectly fine. I mean, I did feel a little bit of discomfort here and there, but I was able to walk. I was able to sleep quite comfortably and all of that. So I definitely recommend seeing an osteopath in pregnancy regularly.
It is. It's really amazing to see an osteopath during your pregnancy, and postpartum as well. To be honest, I get a lot of women coming to me. I think people still have reservations with coming during pregnancy because they are somewhat worried something will happen to the
Right.
baby, or they're just in so much pain they don't want to move around, to be honest.
I know. It's a bit of like,
Yeah,
what do I
it's
do?
a
I
bit
don't
of
want
a
to
hit and
move,
miss
but if
because
I
they're like,
go, I might feel better.
yeah, exactly. Getting on the bed, getting off the bed, they're already like flustered. I understand it. So obviously, it's nothing. It's highly recommended. However, you can't say much if someone's the way they're feeling and how they want their pregnancy to play out. But saying that, these women that sometimes do message or kind of send DMs through, kind of fluke, which I understand, but those same women definitely 100%, 99% of the time come back after pregnancy. They're like, oh no, the baby's out now. I just need my body back. So, and they also feel like, oh, I can't get adjusted. So what's the point? you can get adjusted in your second and third trimester. You can have the spinal manipulations. It's safe to have it, but a lot of people worry as well. So I get that.
Yeah.
It's nothing to be concerned of course. If you're safe to treat, you can be manipulated to your spine every week. It actually helps. But we get a lot of postpartum, so it helps a lot during postpartum as well.
Yeah. I think that postpartum is kind of more let's say well known, or a lot of people, at least the people that I work with, a lot of them start exploring osteopathy after the birth, mainly for the baby, because the baby has some issues like reflux, colic, whatnot. And from there it kind of seeps through to the mom and her own treatments and all of that. So from my perspective, a lot of people start learning about osteopathy after the baby has been born, because lots of lactation consultants advise that as well. Tongue-tie practitioners send babies to osteopaths as well, things like that. So from your perspective, can you tell us a little bit more about how you work with babies, if you work with babies and the postnatal moms?
Yeah, so I do work with babies. I work with babies from a couple of days old, to be honest. It doesn't depend on anything. You as a mum, you can feel like, yes, there's something wrong with the baby, or you can just be like, I've had a little bit of a difficult birth. I want to bring my baby in just for a checkup. Or it could be absolutely nothing. You've had an unremarkable pregnancy and you've had an unremarkable birth, as much as births can be unremarkable. And you bring your baby in. So let me just touch on some of the common things people do bring their babies in for. So some of the common things are colic, reflux, digestive issues, so they're not pooing, like constipation, favoring one side of the boob than the other side, latching issues, etc. So we are not prompted to diagnose whether a baby has a tongue tie or not, and obviously we can't do anything about it procedure wise. However, we can advise to go and see someone if we feel that this child may have a tongue tie. But what we can do a lot of jaw release techniques, working on the neck. If they've got mild torticollis, which is like a little bit of a bent neck, if they've got flat head, so plagiocephaly, if they've suffered from that, it's kind of advising the parents how to do certain things to help the baby get a more rounded cranium, and what the effects can be in the future if it's not worked on now. It's very, very easy to treat a baby under 6 months or in the newborn stage because they're so malleable. It's really nice to treat them in that stage. And those are kind of the common things. I wouldn't say hip dysplasia is a little bit higher up than our expertise. However, we can release the hips and work on the hips and making sure the spine is moving well, and the shoulders. For example, sometimes people ask me what's the difference between what do you see any differences between a vaginal delivery, a C-section delivery, and an instrumental delivery? And I would say yes, I do. With vaginal delivery, there's obviously the compression and the pressure that the baby goes through, right? So sometimes you may see, if there's a lot of pressure, that there's a little bit of a shoulder issue. The baby has a tendency to not completely relax, and those kind of issues. So you want to work through the neck, and you want to work through the shoulder, etc., to kind of bring the baby out a little bit more, to open up the baby a little bit more. With instrumental deliveries, you do see some, I don't want to say dents, but you do see some asymmetry sometimes. You do see some more facial pressure. Yeah, so these baby may have a little bit more latching issues, etc. Commonly seen with C-section babies, they may have more ENT issues.
100%.
Because they're swept up, there's no pressure coming through, so they've not gone through that pressure. So again,
I think that's quite an important point because, lots of people think that if the baby comes through C-section and there is not that pressure of the birth canal, that is actually better for the babies. But actually, babies do need to go through that pressure and that squeezing through vagina. It's like
because this is what's been done for centuries and centuries, and
yes,
C-sections have only been around, I don't know historically, but not hundreds of
yeah,
years. So it is something different, and naturally we are supposed, naturally, babies are supposed to come out through the vagina and have these kind of pressures through them, but yeah, so it's really difficult to say exactly what a baby may go through with different types of birth, but these are commonly what we see. These
yeah.
are some of the common things that we treat, definitely.
Yeah, I think it's also important to say what you said at the beginning, that the baby does not necessarily need to have any problems, or pregnancy could have been uneventful and the birth could have been uneventful, but it's good to kind of go and see an osteopath or maybe another body worker just for that, like, MOT, just check if everything is fine, because at the end of the day, especially the babies, they go through so much development and changes so quickly that inevitably it can be causing stresses on their body, on their spine, on all the structures. So it's kind of good to have a check here and there, because maybe there is this theory that in some traditional cultures and in many places of the world, like in India, for example, they still do these like massages after the birth for mom and baby. And the massage
I'm a big advocate for massage. I feel like
yeah,
baby massage is amazing for proprioception. And like the feeling of touch is so good for
yes,
building those memory cells as well. So I'm a firm believer, and even to my non-Muslim patients, or non-cultural patients, Caucasian patients, who are more, reluctant to do massages unless it's done by a professional or
yeah,
unless it's monitored. I'm like, look, you're not going to harm your baby. You just want to get some
exactly,
baby oil. On colder days, you might put it on the radiator just to give you a little bit of heat. It's really, really nice for the baby in the morning or in the evening to also unwind and let the baby completely stretch out. So I wouldn't say I'm a like baby massage person, or I do baby massages. However, because I've been doing it for many years and I've done it on family as well, a lot of babies in our family, it's just a really nice way to also. I'm like such a big advocate on making sure the bowels are always moving really, really well.
yes,
I think that
yeah,
stems from my own issues of having Crohn's. So when my daughter was born, I was religiously doing visceral osteopathy and moving her bowels to make sure, hopefully she doesn't have Crohn's like myself. However, alhamdulillah, she's fine. But yeah, it's just about getting everything working. So you
yes,
call it a general osteopathic treatment session. You're not coming in with anything specific, but your baby gets the full check. So is their symmetry good? Have they got plagiocephaly? Is there too much tension in their neck? How's their arm stretching out? Have they got a bit of a lift of their head when they're placed on the arm? Those kind of things you're
yeah,
looking
yeah,
for. Are they really hard around the stomach? Have they got you're asking parents the questions, how many poos and pees are they doing? Are they latching? Are they feeding well? Have they gained weight in the last 12 days? All those kind of little real things. So it gives the parents a little bit of reassurance. You also
yes, yes,
educate them of things they might look out for if it's a colicky baby, the high pitched screaming, the arching of the
yeah,
back,
yeah, yeah,
you know, um,
yeah, 100%, 100%,
their
because
reflux,
yeah, all these things are not necessary. I mean, there may be a level of, let's say, reflux, like a little bit of pus
Yeah, of course.
here and there,
You're also telling them what's normal,
linked
what's
to
not.
the development of the gut that is still happening after the birth. But if it's something a little bit more exaggerated or
Mm-mm.
more pronounced. It's always good to look into why it's happening, because babies are not supposed to be suffering and struggling and all of that.
Exactly.
And same goes for mom. Even if her giving birth was very easy and straightforward, it's still a huge impact for the body, right? For the whole, as you said, in pregnancy, as the weight is shifting and everything is kind of moved around, the organs in the belly and the diaphragm and the ribs and everything is stretched and the pelvis. So it's kind of good idea to check it all out, after the birth, make sure that everything is kind of going back where it's supposed to be.
And also, like, after birth, I think, as you know, like, we're just a bit all over the place, hormonally, mentally. There's just been, it doesn't matter if you've had even back-to-back pregnancies, your life has somewhat changed in a beautiful way, but also in a physical way. So I also give a lot of advice to my women on what they should, the small daily habits that they should, to see a difference and build a practice that then eventually stops them getting those aches and pains that typically people will get. So it's about having a pillow to support a newborn, under them while they're breastfeeding, if they're breastfeeding, or even if they're bottle feeding, and not having all the weight on their arm.
Yes.
If you're breastfeeding in the night, sitting right up against the headboard, if possible, if you've got a feeding chair, to sit on the feeding chair. Turn, if your baby's feeding on a breast and you're lying down, change side to side, those kind of little things. Like looking down, because a lot of the time, we're changing nappies, we're bent down over and over again. So touching on, like, looking at a person's lifestyle as well, has that person got multiple children? Are they carers for another toddler? Are they doing a lot of heavy lifting? Those kind of things you're looking at. Has there been a significant change in their weight? So are they usually a size 8 and now they fluctuate to a size 12, etc., etc. Obviously, the weight is very, has a big part to play in our bones and joints.
Yeah.
Mass of it. So, those kind of things.
Yeah.
Doing daily stretches, but making it accessible, making it doable. So maybe after each prayer, you sit on your prayer mat and you do a few gentle stretches that I'll show the person, or little
Mashallah.
things that they can do. Keeping essentials on the bedside table as opposed into cupboards and things like that can make that they might not have thought about, but because you've just planted that seed for them, they're now going to go home and do it or make those changes.
Yeah. And those little changes sometimes are all they need to kind of make their life easier and for the body to move easier and reduce the pain levels and all of that. So it's great that and oftentimes we as mums or parents, we don't see these little things that we can do to make our life easier, right? So sometimes it's good to see someone who is outside of our little bubble, who can have that like helicopter view, let's say, and give us some pointers what we can do to help ourselves to make our lives a little bit easier, smoother, less strenuous.
Yes, 100%. So it's just about making mum's lives a little bit easier, and also then to get them out of that little worry bubble that they might potentially be having, and if there is something to worry about, you put your finger on it and you say, hey, look, this is out of my expertise. I would suggest you going further and checking it out. But other than that, it's quite a beautiful time, and it's a really nice bonding time, and it's a therapy for them. Even if they're bringing their baby in, they know they're doing something about it. That's
definitely. And as you said, even that worrying, sometimes as mums we worry about our babies, so it's good to see someone who may have a bit more understanding of what the babies might be going through, or even the mom, and then say, actually, what you're experiencing is normal, and explaining and putting it into perspective, and giving some sort of reassurance, and that can make all of a difference as well. Talking about this, so we talked about the pregnant ladies, the postpartum, and obviously there's lots of hormonal changes that can impact our posture, the bones, and all of that. Then there is another huge chapter in our lives where hormones are all over the place, and that's perimenopause and menopause. Do you see women through these stages as well, or how can osteopathy help these women going through perimenopause, menopause?
Yeah, actually, in the past, I would say 18 months to 2 years, I've been seeing a lot more people who are perimenopausal, menopausal, postmenopausal. And osteopathy is amazing for those kind of people, actually, because it's really guiding them through the changes their bodies are going through at the given moment.
Mm,
Because a lot of the time, these women who come to me have never had physical pain, or have never had that level of physical pain that they're
yeah,
experiencing
yeah.
now, or issues that they're feeling now, right? So it's about treating them physically but also mentally, because as we know, menopause isn't just about the physical changes that go through the body. It's all about the emotional changes, the mental state change, everything like that. So it's kind of guiding them through that way. I do a lot of advice on the vitamins and minerals and things that women should be taking during those times, and what can help them. And obviously, I'm not a doctor, so I can't prescribe things. However, if I feel like, okay, this is a bit too much, your symptoms are a bit too much, have you thought about HRT? As much as I don't want my patients to be on medication, if they need to be, they need to be honest. But it's about guiding them through that time and reducing the symptoms and educating them that, look, this isn't a short-term fix. You've got this issue. One day it's your elbow. And what I see, if I'm going to be completely honest, is a lot more inflammatory conditions
Mm,
in
yeah, yeah.
menopause and perimenopause. So it's tendinitis or anything itis, so plantar fasciitis, which is a very common one.
Yeah, yeah, it seems to be very common. Yeah.
Yeah, yeah. Carpal tunnel, yes and no. In menopause and perimenopause, frozen shoulder is, I'm treating, I think, 6 women at the moment for frozen shoulder, which is adhesive capsulitis, which is when you are unable to do basic movements like brush your hair,
Yeah,
do up
yeah,
your bra strap. It's basically like super glue on this area. It can happen to
yeah,
anyone, typically between the ages of 30 to 55, women more than men.
yeah, yeah.
If you have a predisposing history of thyroid issues or heart issues, you're more prone to it, but it's not to say
Mm,
exclusively. Um, so those are the conditions that we sometimes treat. A lot of shoulder tension, upper neck tension, headaches, sometimes bowel issues, sometimes flare up of skin issues, which isn't my forte. However, if they're also coming in with joint pain, then
yeah, yeah,
you give them advice on what they can do. So those are typically what we treat and what we
yeah,
see
yeah,
perimenopause and
yeah.
menopausal women for.
And frozen shoulder, that's I've had frozen shoulder in one shoulder first and the other one next year. And osteopathy, honestly, is the one thing that helped. That's also how I learned about osteopathy about
Yeah, okay.
15 or how many years ago when I
Nice.
had the frozen shoulder. Because I needed it to be fixed quickly. I was working as home birth midwife and I had lots of women on my caseload, and I just couldn't, I just needed that
You
arm. I
couldn't, yeah, you could,
needed
yeah,
that.
you
You know,
could
you
physically
can't
not.
function like that. Even driving a car was a
Yeah,
pain, right?
yeah, yeah, yeah.
So, and I went to my GP and they told me, yeah, well, that's going to take a year or more, that kind of stuff. And
Yeah,
I was like,
unfortunately, it can
I
take up to
can't
3 years.
exist like
Yeah,
that. So
yeah,
then I went to an osteopath local to me who specializes in shoulders, back, and neck pain or something. And she fixed me within a couple of weeks. Like for
yeah,
the first shoulder, it was, I think, 2 appointments. For the other shoulder, later on, it was, I think, 3 or 4 appointments. And I was perfectly fine. So, I always tell people, please see an osteopath.
yeah.
It's going to be much faster.
It's also educating them on it, because they're like, oh, why would it take so long? Is you have 3 stages of frozen shoulder. So you have the freezing stage, the frozen stage, and the thawing stage. The most painful one is when it's frozen.
Yeah, yeah.
So this is where it's the most restricted. So doing gentle movements. So one thing I tell all my patients is, they say, sister, when you move it, it kills that a little bit more, but I can't move it. I said, look,
Mm,
your body's natural response is to protect. and protect
Yeah.
and heal, right?
Yeah.
And so when your pain signals come on, it's saying, oh, 5 degrees of movement, 5 degrees of movement, because your brain is stopping you and then you're stopping it, right?
Yeah. Is that
But when
anticipatory
yeah,
fear of pain, isn't it?
fear of pain. But when your shoulder is in my hands and your brain is switched off because you know someone else is going to do this movement for you, and I tell you to relax, you naturally relax. And because I'm not using your brain, so my brain is saying I'm going to move this shoulder 10%. And you're like, whoa, how did that happen? It's because you have that movement, but your brain is not allowing you to see that. So what you're trying to do is you're trying to retrain your muscle memory again, in a way, and you're trying to like get your brain used to that 10% of movement and then slowly increase it, you know? And that's what,
Yeah.
when people say, how can you treat my frozen shoulder? It's about slowly increasing the range of movement, yeah? And doing some gentle exercises at home. Sometimes when you go to a physio, they'll give you these door handle stretches and things like that, which help, but you need someone to mechanically come. So we work
Yeah.
really well with physiotherapists because what we'll do is the manual stuff, then they'll give you more in-depth exercises. Yeah.
Yeah.
It complements each other, definitely.
Yeah. Alhamdulillah. We've got how are we doing for time? Okay, we've got few questions in the chat, so I'm just going to go through them now. So Sister Rabia is asking, Assalamu alaikum, Sister Ishita. I have been diagnosed with osteoarthritis in both knees following an X-ray after I went to GP due to my knee pain, which I thought would be related to hormone changes in perimenopause. Would osteopathy be suitable for that too? As you mentioned joints earlier, as the MSK just referred me for physio with almost 4-month waiting time. Yeah, that's another thing with NHS physio. You often have long waiting times to actually be seen.
Yeah.
Yeah.
So with osteoarthritis, yes, this is a kind of, I would say, like low back is our bread and butter for the, like, let's say 50 plus. It's something that we commonly treat. So it's very, very important for me to maintain your expectations. You cannot heal, you cannot cure, you cannot get rid of osteoarthritis. Osteoarthritis is wear and tear of the bone. The bones have changed, right?
Mm.
This is a natural aging process, as well as sometimes secondary process as well, whether you've had trauma to the knee, whether weight gain, so you've put a lot of pressure to the knee, whether you've been using the knee, repetitive strain. These are secondary issues, but the primary issue is wear and tear, so age-related process here. So commonly affecting the knee and the hips, osteoarthritis, yeah, and rheumatoid arthritis affects the smaller joints. Osteoarthritis affects the bigger joints. So osteopathy can help, definitely. Like I said, the body's natural response is to protect. So your muscles around your knee joint get really, really tight. Your ligaments get really, really tight. Ligaments don't get the same amount of blood flow the way muscles do. So an osteopath will come in and mobilize your joints. So we're trying to separate the femur, so your longer bone, closer to your hip than your tibia, which is the lower part of your leg. What that's doing is that's bringing in healthy blood flow, nutrients, white blood cells into the area. We're trying to keep your synovial fluid, so the fluid between the bones, lubricated as much as possible. Yeah, we're working on your upper leg, your lower leg muscles to really help stimulate blood flow again, so it can kind of relax your leg. Yeah, so you can walk that little bit healthier. So yes, we can prevent it getting worse. Yes, we can maintain maintain the pain and reduce the pain, but we cannot get rid of osteoarthritis. Yeah, so I would say osteopathy is amazing for anything osteoarthritis, even rheumatoid arthritis wise.
Yeah, alhamdulillah. Got another question from Sister Charmaine about babies. How early on can we come with baby age-wise if we wanted a general check?
Couple of days, honestly.
Anytime.
Literally anytime. I've had last week I had a request for a patient to she was seeing me all through her pregnancy, and she just gave birth, and the next 2 days later she messaged me saying, I'm still at the hospital, can you come and see the baby? And I said, okay, how about we get you discharged first? Let's get you discharged, make sure you're all good. But yeah, she literally came. She came after a few days. So the baby was 5 days old, just for a general check. It was a very
Yeah.
fast delivery, hence why she had some concerns. But baby was absolutely fine. If anything, mom was
Alhamdulillah.
a bit frazzled. But yeah, a couple of days, honestly.
Alhamdulillah. Talking about the baby, do you do home visits for babies as well, or do you know about osteopaths that do, or osteopaths generally don't do home visits?
A lot of osteopaths do home visits, a lot of osteopaths don't. I personally don't at the moment. I don't offer it, and maybe in the near future I will. But yeah, all mine is in-house for me
Yeah,
at the
yeah.
moment.
So it
Yeah.
is possible for babies to do home visit and treat at home. For adults, it's probably more challenging because you would need to bring the
It's just that you
bed
just
with
need
you,
the
right?
bed, and you're just more comfortable in your own setting on how
Yeah,
to
yeah,
feed the baby and how to thing the baby, in your own setting and stuff. However, it's definitely a possibility to get
yeah,
someone get someone out to you,
yeah.
to do a visit.
Okay,
But
okay,
yeah.
alhamdulillah. So another question here, please tell us the small daily habits we should be doing probably postpartum. I currently have a 1-month-old Mabruk and a 1-year-old. What would I be focusing on?
Okay, so I'd say 1 month old and toddler, there's a lot of pressure going through the sister's upper body. So what you want to do is you want to do more upper body stretches. So if you can purchase yourself, like for example, a resistant band,
Mm.
so those stretchy bands. So you can kind of hold it on top of your chest, and you can give it a nice stretch like this. So you're kind of stretching out the pecs, because you remember when you're feeding, you're a lot like this, whether that's bottle feeding or breastfeeding, So these muscles get really tight, and that starts to affect your neck. Yeah. So opening up like this is really good. And you're also working on the back muscles, right? And then just sitting and just going side to side. So you're keeping your spine turned side to side. You're also doing gentle stretches. You may hear some clicks. So you're trying to get to the back of the chair. So holding the back of the chair. It's important just to kind of get that rotation and side bending movement going through your spine. I hate this exercise. I'm going to show you one I really hate, which is this one. I really hate that because it's just like, what are you doing to your head? So it's really important to do more isometric, like controlled stretches. So again, you can do things like this, things like this. You can aid yourself in doing it a little bit, just looking down in all vectors, just to give everything a good stretch as well. When you're standing, you can like just rotate your hips outwards, just moving your legs outwards, lying flat on the floor. You can bend your knees to your chest, as much as possible if you've lost the water retention around your stomach. Just hugging your knees and just gentle movements. Walking is amazing, of course. So what I'm trying to say is just gentle stretches is really, really good in the first 3 months postpartum. And then you can get into weight training and things like that. But like I talked about, the habits that you should have when you're feeding and lifting is using your knees to lift instead of your back, so
Mm.
you're not putting too much pressure on your discs. Having a pillow, prop yourself up so the baby's higher and you're not like this. You've got a pillow behind you so you're pushed back against the wall or the headboard or chair or sofa.
Yeah,
And having things a little bit more closer to you,
yeah, yeah.
and so those little things.
Amazing. I would just add that the position when the mom is breastfeeding or even bottle feeding is really, really important. So, because you're going to be doing this several times a day for quite a long time, each sitting, right? So it can impact your posture and it can cause pains around the neck, shoulders, arms, back, all of that. So when you're breastfeeding, it's important to make sure that your position is good in the first place. That's your starting point, mother's position first, and then baby's position. And I don't like breastfeeding pillows in terms of having the pillow under the baby. You need pillows. It can be the breastfeeding pillow or other pillows under your arms because you're holding the baby on your arms. So you don't need to hold the baby. You need to hold or support your arms.
Yeah.
And also oftentimes my experience with these breastfeeding pillows is that they bring the baby too high up. In relation to your breast. So be mindful of that, ladies. Look at where your breast is sitting first,
Yeah, exactly. That's
and
really,
then
really
bring
important.
the baby to the breast rather than breast to the baby, right? Lean back, support your back, sit comfortably.
It's
So
more
that's
about
really, really important.
the position. Yeah, you're right. So it's important to clarify that I never advise a pillow go directly under the baby.
Yeah,
What you said is really important, but it's just so that
under
there's
the
not so
arms. Yeah,
much like there's not so much of this drag. So it's just about
yeah,
that gentle lift of this arm under.
100%.
Another thing that I really I want to also, because I forgot to mention this one of the things that a lot of mums do develop post pregnancy is de Quervain's tenosynovitis, which is trigger finger, so inflammation of the tendons of
Yeah,
the thumbs, and that's often quite missed, but it can be excessively painful to the point where mums may need corticosteroid injections. So my biggest advice is see an osteopath about it, because it's generally just inflammation of the tendon and the muscles around it. And if it's really bad, then you may for a month or two need to wear some splints on your hands just so you can kind of reduce the inflammation. And every day religiously try and ice the area twice a day. Ice is a big help for inflammatory conditions. But yeah, that's just one thing I missed. Common things that we see. Yeah.
Amazing. Sister Rabia says thank you for explaining the treatment for osteoarthritis so well. And then we've got another question, and I think we mentioned it before. Does osteopathy help with sports injuries?
Yeah. So we do see a lot of sports injuries. I'm going to be completely honest because I only work with females, and females are not, Muslim females are not so much in the sporting industry. So I see it a little bit less. However, saying that, I have women from every single profession under the sun. So I'm very prone to seeing issues related to sprains and strains. And yeah, so osteopathy does really help with sports injuries and sports related injuries. I also do kinesiology taping, so K taping, and that really helps with proprioception of releasing, helping the muscle heal with strains and sprains, and letting the muscle lengthen. So yeah, a lot of issues that we see are common. There are girls that I see that do badminton, tennis, a lot of running, cycling, cardio, more gym goers. Yeah, I would say I see maybe none footballers. I don't see any footballers.
Martial artists?
Martial arts, yeah, I've got jiu-jitsu, martial arts, those kind of things I see a lot of. And sometimes they can be quite high impact. I hate when I have to tell my patients to chill out and relax and stop activity, but sometimes it's necessary, the body also needs time to heal.
Yeah.
But recently we've got London Marathon, Hackney Marathon coming up, so I'm seeing a few girls for running that are running the London Marathon and Hackney Marathon. So I'm treating them, releasing their calf tension, releasing lower back tension, so that they're at their optimum.
Yeah.
So that they don't come out with any strains or sprains.
MashaAllah. And we've got another sister here saying, Assalamu alaikum, Sister Ishita. I've seen amazing results with my youngest as a baby and slightly older. He's now 8 years old and has a very blocked ear, but won't let me go near it. I've used oils, ear drops, etc. to try to clear it out, but it hasn't totally worked. Can osteopathy help with that? And also, can it help with bedwetting? Jazakallah khair to both of you for this session via Aki.
Ah, so lovely. With
So it's the ear, blocked ear, and the bedwetting.
Yeah, so the blocked ear, I'm not sure whether this child has had grommets. I don't know.
It doesn't say. It doesn't say.
Yeah. So whether they've had grommets or not, because sometimes, unfortunately, with the positioning of where the ear canal sits and where the balance is with the ear, unfortunately some children will need grommets just to drain the canal ear fluid out of the middle ear into the inner ear. But in terms, if they do not want to go and have grommets, but there's nothing wrong, it's a very, very common small procedure to do.
No grommets, it
No
says.
grommets, okay. So if you don't want to go down the grommet line, then definitely we can do some gentle work around the ear just to help it. Can't promise results because it's something very, very small and very, very niche, but it can be worth a try. Yeah. You'd have to basically have the position of the head quite angled. So you for example, we understand the anatomy of how the ear is supposed to be drained, so we can potentially help mechanically, but sometimes it's very, very likely it's going to come back, unfortunately.
It also depends on what's the reason for that, right? If it's some mechanical blockage or something, or if it's more like inflammation or something.
Yeah. So if you're getting recurrent inflections, I wouldn't say we're the people for you. We're osteopathy for you. However, if it's more mechanical, we can help kind of drain the ear pathway. But if the balance is just still off and it's just the positioning of the membrane, then it's not going to make such a huge difference. But it's worth a try to see if it helps.
It's worth a try,
one session. With bedwetting, again, tricky territory. It's kind of, there's a lot of more psychology behind it. There's a lot more behind it. But if you want to work on the mechanics of the child's low back, hips, bowels, and kind of work on the lower stomach area to just, if there's any tension around the bladder, to be like, why is it getting filled up too quickly, or where's the control coming from? Then maybe you can do it from a musculoskeletal point of view. But if it's more to do with the psychology or something like frequency issue, then that's more of a medical route that you'd need.
Yeah. Talking about that, oftentimes when I recommend osteopathy to sisters, because it's not on NHS, right? Or do you know about any NHS osteopathy services?
Personally, no. There are some hospitals, I'm not sure how many in London, that do offer osteopathy appointments, but like physio, it's going to be a long way, and you're 100% not going to get the same level of care that you do get privately. Hence why under the NHS is very, very minimal, because they also know that our sessions are longer, which is a lot of money for them. So I've had colleagues from uni that I've studied with who've gone into NHS, have not really come out of it feeling fulfilled, because we have a way of treating it, and our philosophy is a certain way, and we don't like to treat our patients like a conveyor belt,
right,
in out kind of thing, and then not follow up. For us, it's really important to build that rapport so we see change, and this is one of the reasons why I went into it, is so I can see change. I can grow.
I think that's a really important point that you're saying, because the patient therapist relationship is really important part of the whole healing process. And regardless whether the therapist is acupuncturist or osteopath or homeopath or another practitioner, you need that relationship. That's why working in the more conveyor belt system may not work that well, or not for everyone, because there's always that emotional or psychological aspect to every treatment, which the relationship that the therapist gives you. That's also why using AI or Google to treat yourself may not work, because you're missing on that relationship, and you are missing on the nuanced approach, isn't it?
And that's another big thing that I'm going to go on to and just touch. I know we're quite a little bit short on time, but it's really important about a lot of people come to me just, or go to an osteopath for a level of therapy that, you're not going to typically go to a therapist for, like a talking therapist or a counselor. For example, you may have a lot of stuff going on in your life that may then manifest physically in your body.
Yeah.
So our body holds a story, our body holds a lot of tension, our body holds a lot of stress, especially females. We're
Yeah.
carrying the world on our shoulders, especially living in the West. There's just so much we have to do as well, depending on our
100%.
cultural background, etc. And everyone comes from a different family, everyone comes from a different background, some people are working women, some people are not working women, but everyone's life is so different. However, we're all very, very much prone to stress, and that stress 100% manifests into our body. Grief manifests into our body, trauma manifests into our body. So I don't know why, but I seem to attract a lot of patients who have gone through some, trauma, or sometimes sinister trauma. So it's really important. We also study psychology at uni, so we are trained to kind of walk through that path with you. However, maybe not give you the same level of tools that a therapist can give you. So we are very good listeners, and obviously everything you share with us in the room stays in the room. As a Muslim female myself, like what you say to me is my mana, so
Yeah. Yeah.
it's
100%.
important. So sometimes I feel like they come in with physical pain, but it's more the mental pain, or the mental stress. And once they offload on you, because you are an outsider, and they feel comfortable, and you create a safe environment for them to talk and share and cry. I've had, amazing vagus nerve releases where I've just had women crying on my bed, and I'll just leave them there for a few minutes just to, calm themselves and let it all out. And then we go back to treating. So it's a very beautiful
But it's
experience.
very important, that safe space where we can actually let go, right?
Yeah.
Because oftentimes at home, we may not feel safe enough to do so, right?
Yeah.
So that is really, really important. And that's what I kind of meant as well, that relationship with the therapist is so important,
It's
with the
so important.
practitioner.
And we're all
So,
different. So
yeah.
sometimes it's important to also find someone you click with,
Yeah, yeah, yeah.
it's someone you click with. So sometimes, you go to your GP, it's very A, B, C, D. You're not expecting them to care that much, and also they
Yeah.
don't maybe care, because for them it's just
10
making sure
minutes, right? In and out.
you're medically fine. That's their job, to make sure you're medically fine. There's no red flags. You're not dying. You're fine. All right. Here's your medication. Off you go. But with us, you're trying to create a bond. You know, um, it's different. So yes, we provide a service, but we also care about what we're
Yeah,
giving, and we do want results. So the same
yeah,
way you want results, we also want results.
yeah. Absolutely, absolutely. The one question that I actually wanted to ask, and we digressed, but nicely digressed, is because it's difficult to get this type of therapy on NHS. A lot of women say, "Oh, it's too expensive for me. I can't afford it." So, what would you say to that? Or do you know about any like cheaper options in terms of osteopathy? What could women do?
Unfortunately, I wouldn't say I know any cheaper alternatives to osteopathy, or having massages, etc., because it is, like, just to justify it, it is 4 years of studying that we do to get to where we are, and a lot of time and money spent on getting to where we are. And we also have to match the rates of the area that we live in, so we're not underselling ourselves or overselling ourselves. Alhamdulillah, I'm in a position where I can talk for myself. I can keep my low rates a little bit low because I have less overheads, for example. However, some people have a lot of overheads.
Yeah,
So as we know, everything's just getting more and more expensive. So I can't say that if a person wants to visit an osteopath, what the second thing they can do is they can go to a student clinic. So they can go to a teaching clinic, sorry. So where, for example, we studied. All right. So the places that we study as osteopaths to
yeah,
become osteopaths, at third year, fourth year, we need to have 1,500 hours of clinical training. So we've seen patients from all walks of life in our clinical practice, where they only pay a very small amount because you're being treated by a
yeah.
student, not by a qualified practitioner. So the only downside as a Muslim woman is most unis cannot guarantee that you can ask for a female therapist, but they cannot guarantee you that the supervisor
Supervisor,
is going
yeah.
to be female or male.
Yeah.
You can ask, some places are quite lenient and be like, hey, yeah, today, so Ishita's working and her supervisor is female, you're gonna be good, you know. So
Yeah.
those kind of things that you can go for that, and maybe work around it, or just say, hey, before the mail comes in, can I just put on my hijab and my abaya or something like that, or an extra piece of clothing or something, so you can work around that, but it's not guaranteed.
Yeah. So basically, there are colleges that offer these like student clinics that are low cost, and I think that goes for most of the professions. I know that
Yeah.
nutritionists do this, as homeopathic colleges do that as well. Acupuncture colleges do that as well. Because all of these therapies, we need to have that clinical experience first before we qualify and have a certain number of hours on our books to qualify. So all of these colleges run
Discounted rates.
student clinics that are very cheap. So yeah. How can we find the colleges clinics? So basically just Google. So if you Google like osteopathic college or something, it should come up, right?
Osteopathic student clinic, yeah.
Yeah, or homeopathy student clinic or nutrition student clinic or something like that. There are many places around the country. And another thing is, probably not for osteopathy, but for other therapies like homeopathy or nutrition, a lot of these clinics are online. So you're not so limited with what you can reach. Obviously, for osteopathy and acupuncture and other body work things, massage, you will need to find something close to you, right? Because that has to be in person.
Yeah, certain things you do need to find that as close to you, like osteopathy, like you said.
Yeah. Okay, so I think that's all. There's just one comment. I wish my eldest had this. I asked him to book with a nutritionist for some health issues, and he decided to Google it on ChatGPT instead. Oh well, may Allah make it successful for him. I mean, it's not always bad, right? You can still Google things or ask ChatGPT, but take it as a first, let's say,
A
first
little bit of a
guidance.
framework. Yeah,
Take it with pinch of salt, because it's there is lots of mistakes in there. It doesn't always give you the right answer. I know that ChatGPT or other AIs can make things up even. So, whatever you get, double check it before you try, and don't rely on it as 100%, right? So it's okay to try, but if you've tried for a few weeks and it didn't work, maybe it's not the right thing for you, or you need slight tweaks or something, and it might be a good idea to check with a practitioner. Definitely don't think that if whatever internet told you didn't work, that discipline does not work for you, right? It probably just was not the right advice for you
right
at that
advice.
point in time.
Yeah. The thing is like we work, the more experience you have, as you know, the more quicker you can tell, because you've seen so much, you can
Yes.
tell, no, this isn't what you think it is, this is what it is. Because sometimes I'll give a short example. I have people that come in and they're adamant. They've figured it out. They've got sciatica. I'm like, you do not have sciatica. I am telling you right now, you do not have sciatica. These are not the common signs and symptoms of sciatica. You would not be able to do what you're doing if you had a true sciatica. You might have sciatica type symptoms, however, it's not a pure sciatica. Only because they've Googled it. Have you seen anyone about it? No. Have you been to the GP? No. Who's told you? Google. Okay.
Yeah.
So it's small things. And also, Google can be a very, very scary place. AI can be very, very scary. Do
Yes.
you know what I mean? Like, you could just type in one symptom, they can be like, oh, you're having a heart attack or
Yeah.
something crazy like that. So
And also,
yeah,
if you ask the same question repeatedly, you always get a different answer.
yeah.
So then again, what's the right answer,
What's the
right?
correct answer? Exactly.
Yeah. So be careful with these things. They can be helpful tools, but if you are dealing with like a chronic long-term condition, I would be really, really careful about not having proper human consultation with someone. Okay. Any last words?
No,
Wisdom.
it was so amazing. It was so fun doing this. It's not something I have done like this before. I've done a few talks here and there in the past few years, but yeah, it was just so fun doing this and so amazing. And I just love talking about what I
Alhamdulillah.
do because I'm so passionate about it, and
I can see it. I can
I just
see
wish
it.
osteopathy was accessible to everyone, and I honestly I really do empathize with people who do not have the financial means. I just wish I could make it accessible and offer. And maybe in the future I
Yeah.
can be in a position to offer a very big discount, etc., etc.
Yeah.
But right now, unfortunately, I'm not. But alhamdulillah, it's an amazing profession that I work in, and I get to meet amazing people
Alhamdulillah.
and do amazing things. So
Amazing.
I hope to grow as well. And yeah, it's just something I
Inshallah.
really
Inshallah. So
like.
if sisters would like to see you, where would they find you? How can they book appointment with you?
So Instagram or my number. They can just message me on WhatsApp or drop me a message on WhatsApp. And then once we figure out a day and a time, then I'll send a confirmation message with my address, etc.
Okay.
And on Instagram, just via DMs.
Are you happy to put your number in the chat for the sisters who are with us here? And then once I put...
All right, let me just message it to you. Is that okay? And then you can put it.
Okay. Where are you based?
I am based in East London, so just a 10-minute walk from Bethnal Green Underground Station.
Yeah. So once I have the recording, I will put it on YouTube and I will link your Instagram to it. And for the ladies who are on my group chat, I will put the Instagram link there as well. And I will share Sister Ishita's number on there.
I've managed to figure it out. So
if you just message me the number, I can share it with the ladies on my WhatsApp group and they can get in touch with you, inshallah, if that's okay for you. All right. Okay, so thank you very much, everyone who has joined us live. Thank you so much, Sister Ishita, for talking to me, for sharing all your wisdom and advice and explaining what osteopathy is about. We all wish you all the best in your practice, and inshallah, we will all see you at some point.
Yeah, definitely. It was so lovely talking to you. All the best. Take care of yourself.
Take care. Jazakallah khairan. Assalamu alaikum. Wa alaikum assalam.
Bye-bye.